Gynae endoscopy essentially over the last 30 years has gradually taken over laparotomy in various gynecological surgery. Initially, it started with simple gynecological surgery such as tubal ligation, ectopic pregnancy, but with better instrumentation, better skill, and better training, more and more gynecological surgeries are now being replaced by laparoscopy. We are looking at not just myomectomy, hysterectomy, and even in oncology procedures, increasingly laparoscopy is the preferred approach. And for a long time, there are many studies being conducted on laparoscopic surgery, comparing to the open approach. And in the early years, most of these studies were focused on feasibility and safety. Limited studies were on the eventual outcome of the surgery. And of course, in recent publications, more and more conclusive evidence is now available that laparoscopy indeed is the preferred approach for many surgery, including cancer surgery. The recent GOG Lab2 trial has concluded that the patient outcome in terms of survival has no difference between laparoscopy versus laparotomy. So indeed now laparoscopy has become the standard of care. So I'm very excited over these new developments. Essentially is that what we are doing in the past, in the last 30 years, we are doing it in the right direction. Robotic surgery first found its role in the urological surgery because very often the urologist has to operate in deep pelvis, and the conventional laparoscopy has limited range of movement of the instruments, and therefore it can be very challenging if you're operating in deep pelvis. The robotic surgery overcomes that because its instruments allow greater range of movement because of the incorporation of the endo wrist. So overnight, many urologists have started the path of minimally invasive surgery in their practice. I think similarly for gynecology, I think there are surgeries that are often more complex and operating in deep pelvis, in the deep pelvic side wall, such as the oncological procedures. And I see that robotic surgery will have a role in such operation. And definitely will, I believe, form the bridge between surgeons who are comfortable with open surgery but not too adept at conventional laparoscopic surgery to offer a more minimally invasive approach to their patient, especially in oncological procedures. But of course, the greater challenge to robotic surgery is that there's a significant capital outlay, and the cost per surgery is definitely significantly higher than conventional laparoscopy. So, and I think that it may not be readily available in all parts of Asia. Right. And whereby many parts of Asia is still struggling to really equip themselves with equipment to perform laparoscopic surgery. As regards to Singapore surgery, I believe that the concept is not new because it has been reported many years back, and its application, such as tubal ligation, and even 20 years back, it has been described in performing hysterectomy, is used in performing hysterectomy. But today, yes, we gain interest among the general surgeon and the gynecologists alike. And I believe it has obvious advantage over conventional laparoscopy is that in terms of cosmesis, it will definitely be better because you have a single umbilical incision that's potentially hidden. It will definitely be better compared to multiple 0.5 to 1 centimeter incisions placed all over the abdomen. But again, I would think that this cosmesis advantage will be most appealing to younger patients who desire to have the best cosmesis outcome for their surgery. Because single port surgery definitely has its challenges and limitations. The crossing of hand at the port, the lack of triangulations, lack of tractions, counter tractions are all well-known limitations in single port operation. So there is of course an obvious uphill task in performing a single port surgery compared to conventional laparoscopy, and definitely he has a significant learning curve. Right. And I think more importantly is that even though there are studies on single port surgery feasibility and safety, but I think again, studies on the outcome of the surgery has not been widely available yet. I would think that APAGE, with its strong establishment in the Asia-Pacific region, continue to play a very important role in advancing education and research in the area of minimally invasive surgery. As we all know that Asia is, in the sense that it comprises countries which are fairly advanced in terms of their healthcare, in terms of their surgical abilities, and there are also Asian countries which are generally lacking because due to socio-economic constraint in both the basic healthcare needs. I think APAGE should have this mission of providing a conducive platform and opportunity for our doctors in this region to advance their skill, knowledge, and as so as to overall elevating the standard of care in their countries where they are in. And I think ultimately, that is probably the most important mission for the society.